27 COVID patients died in Springfield over the weekend. One hospital reports all of their deaths were previously unvaccinated patients. One strategy being used in Greene County to cope with this wave of patients is monoclonal antibodies. Our investigative reporter Angie Racono explains what that is and how it works. Monoclonal antibodies were used to treat President Trump. You may remember hearing about the drug Regeneron. It's proving to be effective in patients battling the Delta variant. These pictures were released by Governor Parson. It's a look inside the new monoclonal antibody infusion center in Springfield. 8 patients were treated here over the weekend. The hope is to ramp it up to 30 per day. Previous trials across the nation show patients respond to these lab-created antibodies.
It's a miracle treatment.
It takes hours of prep and infusion through an IV to get the engineered antibodies, but many patients in hospitals say this works.
I just feel like I got better faster.
All right, I feel hope.
Trials show patients recover quicker and potentially avoid being hospitalized. Monoclonal antibodies are being used under emergency authorization. It must be given early. It's generally for older patients or patients with high risk factors like obesity or diabetes. It's also being used for people who didn't respond to the vaccine because they have a medical condition like cancer or organ transplants. And it's used for those who never got vaccinated.
The Delta variant has required different infusions. You can't use the same antibody that you were using before.
Doctors are learning different variants respond to different monoclonal antibodies. This video from inside the University of Kansas shows another treatment called Bamlan, but it hasn't been as successful with the Delta variant.
These variants have adapted so that those are not any longer very good options, but this Regeneron combination of 2 monoclonal antibodies is still working quite well.
Regeneron was used to treat President Trump. It has shown promise, and it's now in heavy demand.
There was a while where I felt very good about supply. That supply wasn't going to be an issue, and I'm starting to get more worried about that, to be perfectly honest.
Doctors warn supply is limited, and treatment takes hours per patient. The best way to avoid the hospital remains vaccinations. Infusions should not be viewed as a magic bullet, even though they are effective.
The hope is you get this infusion early and we can prevent hospitalizations. We are definitely seeing that in our data. We are seeing, folks that the risk would put them at somewhere between maybe 6 to 10% risk of hospitalization. We have that down to 2 to 3% with people that we've been able to give these monoclonal antibodies to. So that's the hope.
Monoclonal antibodies are just one tool being used in Springfield. The truth is, many people are getting very sick. Today, the governor toured other sites which could possibly treat more patients because hospitals are at capacity. Angie Racono, KCTV5 News.